Question 1. Which patient should the nurse assess first after receiving the shift report? A 40-year-old with pneumonia who is due for a nebulizer treatment. B. A 65-year-old with a BP of 90/60ths mmHg post-dialysis. C. A 50-year-old with a stage 2 pressure ulcer requiring dressing change. D. A 30-year-old with a migraine requesting pain medication. Answer. B. A 65-year-old with a BP of 90/60ths mmHg post-dialysis. Question 2. Which task is appropriate for the nurse to delegate to a UAP? A. Assessing pain in a post-op patient. B. Teaching insulin self-administration. C. Assisting a stable patient with ambulation. D. Monitoring for adverse effects of medications. Answer. C. Assisting a stable patient with ambulation. Question 3. Which situation requires immediate intervention to ensure patient safety? A. Confused patient found wandering in the hallway. B. A diabetic patient with glucose of 150 milligrams per deciliter. C. A patient who missed one dose of their multivitamin. D. A post-op patient requesting a bedpan. Answer. A. A confused patient found wandering in the hallway. Question 4. The nurse should assign which patient to an LPN? A. A newly admitted stroke patient requiring a full neurologic assessment. B. A post-op hip replacement patient needing for pain medication. C. A stable diabetic patient needing reinforcement of insulin teaching. D. A stable patient requiring wound care and oral medications. Answer. D. A stable patient requiring wound care and oral medications. Question 5. Which action by the nurse best demonstrates adherence to the principle of patient identification? A. Asking the patient their name before medication administration. B. Checking the patient's room number before administering medication. C. Looking at the patient's chart only. D. Asking the patient's family member to confirm identity. Answer. A. Asking the patient their name before medication administration. Question 6. Which patient should be seen first during morning rounds? A. A post-op patient with a respiratory rate of 10 breaths/min. B. A patient requesting PRN pain medication. C. A patient with a blood sugar of 110 milligrams per deciliter. D. A patient who needs help to the bathroom. Answer. A. A post-op patient with a respiratory rate of 10 breaths/min. Question 7. What task should the RN avoid delegating to a UAP? A. Helping a patient with meals. B. Measuring oral intake and output. C. Turning and repositioning a patient. D. Administering oral medications. Answer. D. Administering oral medications. Question 8. What should the nurse do first after discovering a medication error? A. Notify the healthcare provider. B. Complete an incident report. C. Monitor the patient for adverse effects. D. Document the error in the chart. Answer. C. Monitor the patient for adverse effects. Question 9. A patient with a wrist restraint asks to go to the bathroom. What is the nurse's best response? A. You must wait until the doctor arrives. B. I will remove the restraint and assist you. C. You are restrained for your safety and must stay in bed. D. Let me get you a bedpan instead. Answer. B. I will remove the restraint and assist you. Question 10. Which patient is most at risk for a fall? A. A 65-year-old with cataracts using a walker. B. A 40-year-old with stable vital signs. C. A 55-year-old who ambulates independently. D. A 30-year-old with a sprained wrist. Answer: A 65-year-old with cataracts using a walker. Question 11. The nurse assigns a UAP to take vital signs. Which action requires the nurse to intervene? A. UAP documenting BP and HR in the electronic chart. B. UAP reporting abnormal vitals immediately. C. UAP interpreting abnormal vitals and initiating oxygen. D. UAP using appropriate cuff size for BP measurement. Answer: C. UAP interpreting abnormal vitals and initiating oxygen. Question 12. A patient is receiving 4 potassium. Which action ensures safety? A. Administering 4 push potassium over 2 minutes. B. Infusing potassium through a central line only. C. Using an infusion pump for potassium administration. D. Allowing the potassium bag to run by gravity. Answer: C. Using an infusion pump for potassium administration. Question 13. What is the nurse's priority when a fire alarm sounds in a patient care unit? A. Pull the fire alarm. B. Evacuate the patients. C. Rescue patients in immediate danger. D. Close all doors and windows. Answer: C. Rescue patients in immediate danger. Question 14. The nurse should question which order for a confused elderly patient? A. Soft diet. B. Vest restraint without time limitation. C. Bed alarm. D. Assist with toileting every 2 hours. Answer: B. Vest restraint without time limitation. Question 15. What instruction is most important to give a UAP assisting a post-op patient? A. Let me know if the patient has nausea. B. Ambulate the patient if they feel like walking. C. Report if the surgical dressing is saturated. D. Offer the patient water if they are thirsty. Answer: C. Report if the surgical dressing is saturated. Question 16. A patient is found on the floor. What is the nurse's first action? A. Call for help. B. Check for injuries. C. Notify the provider. D. Fill out an incident report. Answer: B. Check for injuries. Question 17. What task can the nurse delegate to the LPN in a long-term care setting? A. Creating a nursing care plan. B. Performing an admission assessment. C. Administering enteral tube feedings. D. Evaluating patient teaching. Answer: C. Administering enteral tube feedings. Question 18. Which patient assignment is most appropriate for a float nurse from pediatrics? A. A post-op patient with complex dressing changes. B. A stable patient requiring routine medication administration. C. A newly admitted patient with sepsis. D. A patient requiring central line management. Answer: B. A stable patient requiring routine medication administration. Question 19. A nurse observes a co-worker improperly disposing of sharps container. What should the nurse do? A. Report the co-worker to law enforcement. B. Document the incident in the patient's chart. C. Confront the co-worker in front of patients. D. Follow facility protocol for reporting unsafe practices. Answer: D. Follow facility protocol for reporting unsafe practices. Question 20. What is the priority nursing action to reduce surgical site infections? A. Administer antibiotics 4 hours post-op. B. Ensure sterile technique during dressing changes. C. Use clean gloves when handling surgical wounds. D. Change dressing only when saturated. Answer. B. Ensure sterile technique during dressing changes. Question 21. Which situation requires the nurse to file an incident report? A. A patient refuses a scheduled medication. B. A visitor slips and falls in the hallway. C. A patient eats a snack before surgery. D. A family complains about food quality. Answer. B. A visitor slips and falls in the hallway. Question 22. Which action by a new nurse requires immediate correction? A. Applying gloves before emptying a catheter bag. B. Checking two identifiers before medication administration. C. Recapping a used needle after injection. D. Elevating the side rails on a confused patient. Answer. C. Recapping a used needle after an injection. Question 23. Which task is appropriate to delegate to a UAP? A. Administering a saline enema to a constipated patient. B. Feeding a patient with impaired swallowing. C. Obtaining a stool specimen. D. Educating a patient on dietary restrictions. Answer. C. Obtaining a stool specimen. Question 24. What is the priority when transferring a patient from bed to wheelchair? A. Allow the patient to move independently. B. Lock the bed and wheelchair brakes. C. Use a gait belt only if the patient requests it. D. Remove the footrests after the transfer. Answer. B. Lock the bed and wheelchair brakes. Question 25. A confused patient attempts to remove their fore. What is the most appropriate action? A. Apply wrist restraints immediately. B. Call security. C. Cover the foresight with a protective sleeve. D. Leave the patient alone and observe from a distance. Answer. C. Cover the foresight with a protective sleeve. Question 26. What should the nurse do first after discovering a patient with labored breathing? A. Notify the healthcare provider. B. Administer a prescribed bronchodilator. C. Raise the head of the bed. D. Call respiratory therapy. Answer. C. Raise the head of the bed. Question 27. Which instruction is essential for preventing medication errors? A. Rely on pharmacy for dose confirmation. B. Administer meds based on color and shape. C. Avoid questioning unclear medication orders. D. Clarify unclear prescriptions before administration. Answer. D. Clarify unclear prescriptions before administration. Question 28. Which patient is at highest risk for developing a pressure ulcer? A. A mobile patient on a low-fat diet. B. A patient with diarrhea and incontinence. C. A patient ambulating twice daily. D. A patient with BMI of 24 and no comorbidities. Answer. B. A patient with diarrhea and incontinence. Question 29. What action promotes patient safety during medication reconciliation? A. Assuming the pharmacy has the latest list. B. Verifying current medications with the patient. C. Reviewing old orders without verification. D. Only checking the EMR for past prescriptions. Answer. B. Verifying current medications with the patient. Question 30. What should the nurse prioritize when discharging a patient on anticoagulants? A. Schedule a follow-up dental appointment. B. Review dietary changes to increase vitamin K. C. Teach signs of bleeding and when to seek help. D. Discuss exercise routines. Answer. C. Teach signs of bleeding and when to seek help. Question 31. What is the best way to prevent falls in a high-risk patient? A. Place the call light out of reach to limit movement. B. Use bed alarms and keep items within reach. C. Keep the patient restrained during sleep. D. Allow the patient to ambulate independently. Answer. B. Use bed alarms and keep items within reach. Question 32. Which situation should be reported to the charge nurse immediately? A. A nurse floats to a unit they have never worked in. B. A UAP requests a day off next week. C. A patient refuses their dinner tray. D. A family member asks about a discharge date. Answer. A. A nurse floats to a unit they have never worked in. Question 33. Which assignment is inappropriate for an LPN? A. Administering oral medications to a stable patient. B. Assessing a newly admitted trauma patient. C. Reinforcing discharge instructions. D. Performing sterile dressing changes. Answer. B. Assessing a newly admitted trauma patient. Question 34. A patient receiving morphine reports difficulty breathing. What is the nurse's priority action? A. Document the finding and reassess in 30 minutes. B. Call the provider for new pain orders. C. Check oxygen saturation and respiratory rate. D. Reassure the patient and raise the head of the bed. Answer. C. Check oxygen saturation and respiratory rate. Question 35. Which intervention is most important to prevent wrong site surgery? A. Rely on verbal confirmation from the patient. B. Mark the surgical site and confirm with the team. C. Ask the family to verify the surgery location. D. Trust the surgeon's judgment alone. Answer. B. Mark the surgical site and confirm with the team. Question 36. The nurse assigns a UAP to assist with feeding. Which instruction is most important? A. Feed all patients quickly to ensure schedule adherence. B. Assist the patient lying flat in bed. C. Watch for signs of choking or aspiration. D. Offer fluids before each bite. Answer. C. Watch for signs of choking or aspiration. Question 37. A nurse enters a room and finds a fire in a wastebasket. What should the nurse do first? A. Close the door and contain the fire. B. Extinguish the fire with a fire extinguisher. C. Rescue the patient from immediate danger. D. Pull a fire alarm. Answer. C. Rescue the patient from immediate danger. Question 38. What is the most appropriate action for a nurse who notices a colleague diverting narcotics? A. Discuss it privately with the colleague. B. Ignore the behavior unless harm is caused. C. Report the incident according to facility policy. D. Talk to other staff members first. Answer. C. Report the incident according to facility policy. Question 39. A patient is allergic to penicillin. What should the nurse do before administering ampicillin? A. Give the medication and monitor closely. B. Call the pharmacy for clarification. C. Verify the allergy and notify the provider. D. Ask the patient to sign a consent. Answer. C. Verify the allergy and notify the provider. Question 40. Which action promotes a culture of safety in healthcare settings? A. Ignoring minor errors to avoid blame. B. Punishing nurses who report mistakes. C. Encouraging open communication and reporting. D. Discouraging reporting to protect reputation. Answer: C. Encouraging open communication and reporting. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!